Health Association and the former health commissioner in Philadelphia. I've been working for more than 25 years in the field of public health, and I've seen firsthand the incredible dysfunction of our healthcare system. I speak today in support of House Bill 1660, the Family and Business Health Security Act. I was told that PowerPoint presentations would not be allowed, so I offer my written comments today. As a lifelong Philadelphian and a public health physician who began my career working in a public health clinic here in Philadelphia, caring for uninsured patients, I have witnessed firsthand the devastating effect of living without health insurance. Today, all of Pennsylvania and its largest city, Philadelphia, are in a healthcare crisis. The state has between 1 and 1.4 million without health insurance, and these numbers have most certainly worsened because of our current recession. Our current recession illustrates the failure of our market-based approach to financing healthcare. A rational, humane healthcare system does not kick people in their gut when they are down and out of a job. But that is exactly what happens in America. At the very worst moment of people's lives, when they lose their jobs, they also lose their health insurance. The average cost of COBRA is around $1,000 a month, which is virtually impossible for those who are unemployed. Only 9% of people offered COBRA are able to afford it, which essentially means that COBRA is a worthless program at a time when people desperately need it. Compare that to virtually every other civilized, developed country, such as Canada or in Europe. Yes, they are also experiencing their own recession, but they have deemed it essential that their countries maintain their health care safety net for all their citizens. Those countries realize that they must provide health care, especially if one loses their job. You might ask, how can they afford it? The most amazing thing about all of this is that those same countries are able to provide universal health care for all their citizens and still spend between 40 to 50% less per capita on health care than we do. And not only that, but they manage to balance their own federal budgets year after year for the past decade. What is their secret? Those countries have a single-payer or highly regulated insurance system that requires that everyone must be offered health insurance at an affordable price. They forbid for-profit health insurance. The country with the lowest administrative costs in the world is Taiwan, who, interestingly enough, modeled their system after our own government-run health Medicare program. Their administrative cost for their single-payer system is 1.6%, even lower than the 3% administrative cost of our Medicare program, and far cheaper than the 15 to 25% overhead of our private health insurance wasteful system. What do these countries do